COVID vaccination rates among children under age 5 have peaked and are now decreasing. That's according to a new survey by the Kaiser Family Foundation. Researchers also found about 40% of parents with young kids say they have no plans to get them vaccinated. KRON 4's Gayle has reaction now from one local health department.
Parents are sort of proceeding with more caution on getting vaccinations for their children than they were as adults getting them for themselves.
Liz Hamill studies public opinion at the Kaiser Family Foundation. The organization surveyed parents to determine vaccine hesitancy in young kids.
There's a much larger group that says they want to wait and see before getting their child vaccinated. And then a really large share, about 4 in 10, that say they just don't plan to get the vaccine for their child.
This is a choice. It's not a mandate.
As of Wednesday, about 30% of Marin County children ages 6 months to 4 years old have gotten their first dose. Marin County Public Health Officer Dr. Matthew Willis says that's about 3,000 of the some 9,000 children in the county.
The success we've had with those 3,000 that have gotten vaccinated thus far, the vast majority of them have been vaccinated within the walls of their healthcare providers' clinics, especially our pediatricians. So we're grateful that our pediatricians have really stepped forward, and we're supporting them in every way we can to get even more children vaccinated.
Despite the Kaiser Family Foundation surveys, overall Bay Area vaccination rates are higher than the national average, which is 3% of children who received their first dose. About 21% of children under age 4 got their first shot in San Francisco County. But the national findings revealed parents have their reason on why they don't plan to get their child vaccinated.
They are concerned about potential side effects and the newness of the vaccines. And then also the fact that most parents haven't had a chance to talk to their child's pediatrician or another healthcare provider about these vaccines.
Dr. Willis cautions parents to know the health risks.
Children are, in fact, less likely to become severely ill with COVID-19. That's been true throughout the pandemic, remains true. But lower risk doesn't mean no risk. Children are still ending up in the hospital. We're still seeing pediatric deaths from COVID-19. Any one death is obviously tragic and preventable with vaccines.
Gayle, KRON 4 News.